Hello and welcome to Module 2 of the Bigg Elimination Tribute Project for the Building Provider Capacity for Hepatitis C Prevention Program Integration. Module 2 will focus on diagnosis and screening. My name is Jill Wolfe. I am the Hepatitis C Program Director at the Caring Ambassadors Program. This project was co-created in collaboration with the Chicago Recovery Alliance and has been adapted from a training that we did in October of 2019 in Chicago. It has been adapted to be 7-module online self-paced format, and we are grateful to our sponsors for their support of the program. As the name indicates, this project is in honor of Dan Bigg. He was the executive director for the Chicago Recovery Alliance, a fierce hepatitis C elimination advocate, and was known as the godfather of naloxone. We miss him tremendously, and it's with his spirit that this project has been developed. The overall project goal is to help build your capacity, confidence, and knowledge to integrate a responsive hepatitis C screening, testing, linkage to care and cure, and support services into your existing infrastructures. As we've said, this is a 7-module series. Module 1 was broken up into 2 parts. We will cover screening and testing today. You will see the rest of the modules here. The purpose of this module is to break down the various hepatitis C testing options, minding the necessary legal documents and the reporting codes. By the time we are finished with this module, you should be able to explain the process of hepatitis C screening and testing. You should be able to utilize the tools offered to modify existing protocols or services to ensure that your testing programs are comprehensive and that they're following all administrative reporting codes, and that you'll be able to modify your existing services to support the components of a Hep C counseling session. As with all of our sessions, we will tee each one up with words of wisdom and with the spirit of nothing about us without us from our storytellers. So let's start this first one.
Tell me a little bit about your experience with hepatitis C.
Well, I didn't even know I had it till the clinic sent me to my yearly physical, and it came out that I had that hepatitis. I said, but I don't shoot up. I haven't shut up in ages. They told me I could catch that. I'm not sexually involved with nobody for years now, but I don't know how I got it, but I had it. Mm-hmm. You know, they couldn't.
And then let's hear from Luke.
Well, what did not work for me, like I said, is, and I don't argue brain science, I don't argue infections, but you know, when we're going into a healthcare provider, we're nervous. Our lives are already in chaos. We're struggling to find order in our own lives. We're struggling to find, you know, our next, where we're going to get our next fix from, because we're going to go into withdrawal. We're the least of our worries is, you know, an infection in our belly, for example, because we know by going to a provider that's going to create more chaos in our lives. So I think it's very important to understand from the provider perspective that the people that are coming through the door are nervous. We're scared, and there's so much going on in our lives, and coming to a provider could also create more chaos as well. If we find out we have an infection, you know, we'd rather not know, you know,
So one piece I really want to point out here is with Juanita's story. You know, this is someone she talked about in her introduction in module 1, starting her use with drugs at 17, and now within her 60s, you know, unclear on Hep C. And Luke, I think some of what he talks about is keeping in mind some of the state of being with some of the folks that we might be working with and offering testing, and that potentially a test or a result could, just as he said, introduce more chaos into someone's life where they're already nervous. So let's jump in here to screening and testing for hepatitis C. very recently, actually, the CDC changed their recommendations to say that all adults 18 years and older should get at least once in a lifetime testing for hepatitis C. They do indicate in settings where the prevalence of hep C infection is less than 1% is not necessary. However, I think that one thing to point out here is the importance of everybody getting a test and standardizing this, especially to help normalize and destigmatize. You'll be able to see on the CDC website, they have the testing algorithm, and we're going to go ahead and walk through some of this here. I do want to keep in mind some of what we talked about in Module 1 in terms of virulence and how infectious hepatitis C is or isn't. And we had talked about roughly 75% of people develop chronic infection once they've become exposed to the virus. So one thing I really want to make sure we point out here is that 75-ish% of people will have chronic infection, and about 25% will do what we had called spontaneously clear. That's important for us as we understand this algorithm. So let's walk through this. We start with an antibody test, and one thing, and I will continue to drive this home, especially in some upcoming slides, but is the importance of semantics and terminology and how we talk about hepatitis C screening and testing. And sometimes this gets conflated with HIV, which we oftentimes refer to as testing and screening, but there's a different step process here. And so I might use those interchangeably, and I will do my best to point out the distinction. We're going to talk about a hepatitis C antibody screening. This is ultimately the first step in testing someone for hepatitis C. And hepatitis C, if the antibody is negative, means it's non-reactive and that person has not come into contact with hepatitis C. You'll notice here that we don't use positive or negative with this antibody test. We talk about reactive or non-reactive. And so someone who has the non-reactive hep C test, we would stop right there. Ultimately, they've never been exposed. Now, if someone got a hep C antibody test and it was reactive, or we could say positive, this doesn't necessarily mean that that person has hepatitis C. It means that this person has been exposed to hepatitis C. And this is where the testing process for hep C is a little bit different than what we see in HIV. If someone has a reactive antibody, we need to confirm with a test to identify if that person has chronic infection. Were they one of those 25 people that spontaneously cleared it? Or were they one of those 75 people that developed the chronic infection? So what we would do is we would test for, this is referred to as a few different things. Here it's hepatitis C RNA. It could also be confirmatory test or PCR or viral load. Talk a little bit more about this later, but that's the next test once we've done the screening. And if there's no detection or if it's negative, that person has no current hep C infection, and they would be one of those 25. They would be the ones who are able to spontaneously clear. We talk about additional testing as appropriate. Now, for those whose confirmatory or RNA test is detected or positive, means they have current active infection, and they were one of those 75 people that went on to develop chronic infection after exposure. And what we would want to do with that person then is link them to a cure. One of the things that's really different here, and this is vital that we get the language correct when we're educating our folks, is the difference between an antibody reactive or non-reactive and a PCR or confirmatory reactive or non-reactive. So let's go ahead and go through this again together. So if someone's hepatitis C antibody was non-reactive, it means that no antibody was detected and that person has never come into contact with hepatitis C. If their antibody is reactive, we presume that they have hep C infection, mostly just for a universal precaution and also to protect that person's liver until we find out if they do in fact have chronic infection. So a reactive antibody means they've been exposed, and we're unsure at this point if they're one of those 25 lucky or one of those 75 others who develop chronic infection. Only if someone's antibody is reactive does that take us on to the next step of testing, which is determining viral load. Another way to refer to it is an RNA. If the antibody is reactive and the RNA is detected, that means that person has chronic infection. They're one of those 75 folks, and we would want to go ahead and get them cured. But if their antibody's reactive, but the PCR or RNA was not detected, that means they've been exposed, but they do not have current infection. They're one of those lucky 25. Bringing up that importance of semantics and clarifying the words that word choice we're using and when and why. And for the purpose of Hep C, we do distinguish between screening and testing. For the purpose of a hepatitis C diagnosis, our ideal setting and situation is that we screen them. In some cases, it's most appropriate to do it with that rapid antibody screening. And if that antibody screening is reactive or positive, we would then go on to test them and confirm them. And the only way to do that is with serologic testing or blood testing. And a few different ways we would refer to the testing or confirmatory, again, different than screening, which is just antibody. The testing confirmatory is called an HCV viral load, a PCR, or an RNA. Those are all the same things all different words to refer to the same thing. So a few things to consider as we walk through the rest of these modules here. We're going to talk a little bit about laws and consent, what is required for reporting, CLIA waivers. We're going to talk about physician standing orders, quality control, and the types of screening and testing that we're doing, from the rapid point of care and the whole blood, or what's called venipuncture or serologic testing. There's a few things to consider, and I've heard this over and over from folks who work in HIV or who've been trained with HIV prevention and testing, is we oftentimes conflate the laws for Hep C testing and HIV testing. And while we certainly recommend that you get the consent of someone before you test them for hepatitis C, it is not a law in the same way that it is for HIV. HIV, there is a law. Okay, and oftentimes we conflate this, and I've heard programs say, oh, well, we can't test them because we didn't get their consent. And Hep C is different. I'm pointing out this article of this patient acceptance of this universal screening for Hep C infection. And ultimately, we show that patients often support this universal screening that we oftentimes set up as this opt-out model, that our standard of care is that we test everyone unless they opt out of testing. And the opposite of that would be an opt-in. The opt-in model would be, we don't test anyone unless they say yes, they want to be tested. Now those concepts sound pretty similar, but you'll yield different results in an opt-in or an opt-out model. So that's something that's important to think about as you set up testing into your program, how you're going to introduce this to a patient or a client. In terms of reporting requirements and things to consider, so hepatitis C and A and B actually are all required to be reported. And if you recall in Module 1, in 1B actually, we talked about, might have been 1A actually, we talked about all of the 60 nationally notifiable conditions. And that's ultimately the government, federal government says that all of these things are reportable, and they leave it up to the states to figure out how to do that. And so I'd encourage you to look at your individual state system in the process by which you are to report a positive hepatitis C test. I'm going to use Illinois as an example. And in Illinois, hepatitis C is a reportable condition, and you'll see this part and subpart and section that it's in. And in Illinois, we need to report all positive or reactive screening or tests. That includes antibody and the confirmatory PCR. Now, one thing that's important to talk about is ensuring that while we also report to our departments of health, and hopefully we have a relationship with someone there, if not from a viral hepatitis department, making sure that you're able to tell them how many negative tests that you also conducted. Because while it's really important for them to know about how many people are positive or reactive, it means more if they can know how many people were tested at large to find that specific number of positive tests. So in order to help determine real positivity rates, consider reporting your negative tests to provide that N so that we'd be able to find a true prevalence rate. All of this within, part of the reason this is so important is such minimal dollars are given to states and cities and departments of health to actually fund surveillance or disease intervention services within viral hepatitis. And so this is just one way we can help support finding what our true prevalence is. This next form is just a slide, is just the form from the Chicago Department of Public Health, and probably your departments of health, it could be state, it could be city, potentially even county, depending on where you are in the country, will each have their own form. And this is what the Department of Health talks about. And it quotes that it's reportable and where you'd report it, and the patient information and demographics and transmission information. And this is vital for you to find out what the reporting form is from your Department of Health, so that when you put together your consent forms or your testing forms, you're able to match it up to what is required should someone have a reactive test. One thing that we will provide in the resource section is a sample consent form and screening form that you can use with someone that you're testing, and you can make that your own. And often those will follow specifically what's required if that test was positive. Let's move on to regulations and testing with CLIA waivers. And CLIA waivers are something, this is federal legislation that is ultimately determined by your individual state. And so you would receive a CLIA waiver, and CLIA is an acronym for Clinical Laboratory Improvement Amendment. And you'd work with your state Department of Health in order to receive a CLIA waiver. And I'm going to read this definition because many people have heard CLIA and have no idea how or why it would relate to their harm reduction or prevention program. But the CLIA defines a laboratory as a facility that performs testing on materials derived from the human body for the purpose of providing information on diagnostics, prevention, and treatment of any disease or impairment. If you perform any testing as defined by CLIA, you're considered as having a laboratory, or you are a laboratory. And this does include antibody screening. And again, I put that little asterisk by testing because the interchangeable words that we often use. So this is an important thing to focus on. And as I said, you do get your CLIA waivers from your state Department of Public Health. And these tests that are waived, our CLIA waive test, is waived by the FDA. And the FDA has said these tests are simple enough to perform by any lay person and has an insignificant risk of erroneous results. This is true for diabetes testing and glucose, HIV, hepatitis C. All of these are FDA approved and waived CLIA tests. You must apply for your CLIA waiver using that specific form. You can find that online. But again, I encourage you to check your state for an application number. But it's important that if you're a program that's already testing for HIV or any STIs, that you add hepatitis C onto your CLIA waiver if you already have one. And here's a little bit more specific and granular information on if you are a program that has multiple sites where you'll perform tests. There are specific ways in which you would register with the state. So I'd encourage you to look specifically at that. Now, with screening and testing, some things important to keep in mind are program considerations like physician standing orders. Another way you might hear about this is PSO, physician standing orders, and we use them to streamline and standardize care for anyone who meets a specific criteria. A PSO is vital to maximize the full utility of any healthcare professional within your program because it empowers them to utilize the tools and resources at their disposal while they have a patient in front of them. Physician standing orders are pre-written instructions and protocols from oftentimes the medical director of a program. And most programs will have a medical director if they're doing even within addiction treatment or any type of prevention programs. And this PSO allows for other healthcare professionals, it could be health educators, nurses, MAs, PAs, to share in the patient care and lets everyone function at their highest ability. If you're a program that has health educators or case managers do intakes, having a physician standing order for someone who might meet certain criteria to receive a Hep C or an HIV test, having those relevant physician standing orders in place allows that person to just go ahead and test them without needing for that person to see a specific doctor and wait for that process to happen. For your program, some relevant physician standing orders I encourage you to look into or to have is for Hep C testing itself, and not only the screening, but the confirmatory testing, hepatitis B testing, and for vaccination. And module 3 is vaccination, so we cover a little bit more of that, a little bit more on the PSOs for hepatitis B vaccination and management, and also physician standing order for naloxone distribution. And this is something that Illinois has been really progressive about, especially with some of the work and advocacy work done with some of our opioid use advocate programs. Certainly Chicago Recovery Alliance and Live for Lolly has been huge in allowing for Illinois having this standing order for naloxone. And what this is it's a statewide order that authorized trained and licensed pharmacists and overdose education to distribute naloxone to anyone who requests it for the use of reversing a potential opioid overdose, even if they don't have a prescription to do it. As you can see here, this was issued in 2017 by our chief medical officer within the Illinois Department of Public Health. And this has made access to these types of necessary harm reduction tools. This has been really helpful in distribution. So I'd encourage you, if you don't have one of these in your state already, certainly could be a really great advocacy measure to work with advocates to get something like this in place in your state. Let's talk a little bit more about things to consider. So there's a few different ways that you can test for hepatitis C or screen for hepatitis C. One way is through phlebotomy or lab-based whole blood testing. This is, think about you have a clinic and you bring people in and you take their general CBC, or you just do, general lab. And if this is the case, one thing to consider is being able to add hepatitis C as one of the standard tests that you offer for people who are 18 and over. And they only need to be tested once unless there's ongoing risk. This is something we'll discuss a little bit more further. But if this is something that you want to include in your standard of care, be sure to know that there's the option for hepatitis C testing. And we're also going to need to do reflex testing. And a quick layperson explanation of reflex testing is that once let's say I'm the patient and the nurse takes my blood and the blood goes into the lab and they test for hepatitis C antibodies. They screen for hepatitis C antibodies. And if that's positive, what would make the most sense in terms of diagnostics and certainly saving time and resources would be to automatically find out if that RNA is positive too. So we wouldn't want me to come back in and have to get my lab drawn again. No, we would, once that first antibody is positive, we do what's called it reflexes over. The lab is able to reflex over into that next sequence of testing to find out if that person is indeed chronically infected with Hep C. And so if you're going to do this based in your standard of care, in your lab practices, be sure that you talk with your laboratory representative and add that reflex testing and be sure that that's checked. Another option is this rapid point of care test. Right now, OraSure Technologies is the only manufacturer of the FDA approved CLIA waived hepatitis C screening kit. So that's what we will be talking about today, is this option, the OraSure screening kit. Want to make sure we talk about quality and control and technology with this. And so because OraSure is the only manufacturer of this rapid test kit, we want to make sure that we speak with them and their professionals to learn the best about quality control and being able to use what are called controls as we test and make sure that the rapid test kits we're using are still viable and that they're not expired or anything. So OraSure tests the rapid point of care test. I want to remind you, it screens for antibodies. It only determines if someone's been exposed to the virus. It doesn't tell us if that person has the virus. It takes about 20 minutes for the results to happen. It is FDA approved and it's CLIA waived only for a single drop of blood. I know some people think about the HIV test and where you were able to use a drop of blood for the HIV test and eventually an oral swab just to get the inside of someone's oral tissue. That is not the case with hepatitis C right now. The FDA has only approved to run the Hep C screening with this rapid point of care test with a single drop of blood. What's really great about these rapid test kits is the ability to offer screening at different outreach and health fairs out, especially within the community. And so at Caring Ambassadors, we've been doing testing for years, and I'm going to show you a few things and share a few resources. I'm going to show you this setup here, and then the next slide we're going to talk a little bit about how you run a test and the process by which you run a test. But these are the resources and the tools that you're going to need to set up a rapid testing. And I'm going to start with A, which is over here. This is what we have as the testing log or the lab record. And this is where the lab technician, in this case, it might be you or it might be someone else, is able to keep track of how many tests were run and when the lab test was taken, and especially because the specimen can only be run for 20 minutes. After 20 minutes of the test being in the solution, you need to read the test. And so if you're running multiple tests, it's easier to see if you keep a log of everyone who's tested. On B here, these are the tracking labels. We don't like to use the specific name of someone while we're at a testing event throughout the time. So you'll see here, over here, D, this is our screening form, which you're gonna be able to see a copy of on the resource page. And we certainly collect information from someone here. What we do is we take these random serial numbers and we will use them to track someone's test and assign someone a serial number versus their name. So what we would do is we put a log number here, and we would put a log number on their consent form. We would also put a log number on their test themselves. So that's something that's been really helpful for us to track a test through the time of actually taking the specimen and putting it into the lab. See here, you have a timer, and so you would preset them to 20 minutes. And once you take your test and you dunk it, then it would, you'd press this, and 20 minutes later, you'd read the results. D, we just went over the consent form here, and down here, this is where someone provides consent and they sign off. E, you've just got some gauze, and you'll see why you need the gauze in the video that we'll do next. You'll need a Band-Aid. You'll need an alcohol swab. And then we get specific to the test kit itself. This H is referring to this little dude here. This is a test loop, a specimen loop, and this is how you collect the little drop of blood. Be sure to save extras that you might have of these, because these are often hot commodities that are hard to find. This is the test kit itself. On one side, over here, this is where the tube will be, and over here, the actual test kit is there, which is not pictured here, but you'll see this in the next video, I believe. This J right here is referring to the test tube stand, this blue thing. And this is where you would keep the specimen tube. This has got the solution and the reagent that will run the test. And this is where you would dunk the test. And so this little test tube stand helps keep it upright and so that you don't spill. We've got a lancet over here, and you'll need some lancets of different sizes depending on populations that you might be working with, who might have more calloused hands than others. I also have here, we call these chucks or absorbent pads, and we always cover up our station, oftentimes using paper towels if chucks are not available. We have our sharps container to go ahead and put our lancet, and you have a magnifying glass. This is oftentimes used for the lab technician so that you can read a positive or negative test. And of course, you'll want to be sure that you use universal precautions and use gloves always. And we have a mention here of running controls. A control is necessary to run on your test kits, and test kits come in lots or boxes, which we call lots. And you want to be sure that you test your lot of test kits every single time it changes temperature, or you have a different technician who's running the test kits. And so I'd highly encourage you to go on to the OraSure Technology website, which we're going to provide to you in the resource section and in just a little bit. to be sure to go through how the controls are appropriately run, because controls are items and supplies you need to purchase separate from the test kits themselves. Just so you know, for budget's sake, test controls cost about $25 each, and they should last you about 6 months. And you use those over multiple times, you're able to use the controls. For the test kits come in lots of 25 or 100. And I would, on average, for the purpose of your budgeting, I would budget about $20 per test kit. And I would budget about $1 per test for all of these other supplies. That is the best way that I've been able to budget for programs moving forward. Now we're going to go ahead and watch a video that we've put out talking about the process of how you would run a test kit. Oftentimes, Caring Ambassadors does live testing at health fairs or music fests, and so this is one example of that.
This video is a quick overview of providing rapid hepatitis C testing in a health fair setting. Before your client sits down, make sure that all of your supplies are laid out and available and within arm's reach. While you're getting prepared, make sure that you have conversation with that client to make them comfortable, introduce yourself, and begin explaining the things that you're going to be doing step by step. Before you open the OraQuick Rapid Hepatitis C Test Kit, you need to make sure that you check the expiration date. In order to protect the actual testing device, do not open that until you're ready to actually insert it into the reagent. Your next step is to prepare the site where you're going to use the lancet. My preference is the middle finger. It's longest and it's easiest to manipulate. You're also going to withdraw one of the OraQuick Rapid Hepatitis C test loops for the specimen collection. You're going to need to have alcohol swabs as well as gauze available. Clean the fingertip thoroughly. Sometimes you need 2 alcohol swabs, and then use gauze to dry the finger. Uncap your lancet and ask the client to hold their finger upright. That way, any blood that's collects at the top of the fingertip rather than dripping down. You're going to use the lancet, press firmly until it clicks. Express 1 drop of blood and wipe it off, and then express a 2nd drop of blood. That's the specimen that you're going to collect using the loop. It's very important that you do not touch the skin when you're collecting the blood and not to get too much blood on the loop. Take that loop and insert it into the vial, making sure not to touch the sides of the vial and to put the loop directly into the reagent or liquid at the bottom, and then stir vigorously. At this point, you're going to open up the other side of the packet and withdraw the OraQuick Rapid Hepatitis C testing device. Insert the device directly into the tube and make note of the time that you've done that. Pick up the timer, which should be set or preset to 20 minutes, and start timing. You'll record the time that the test started after you bandage the patient's finger. This is a good time to touch base with that client to see how he or she is feeling, what they think about the test, and to ask what other questions they may have. As you're wrapping up your conversation, you can also clean up your workstation. Ensure that there are no contaminated products or supplies that have been used out there. If you put everything into one gloved hand and pull the glove over it, as long as the sharps and medically contaminated equipment has been disposed of, these gloves can go into a regular trash can. And then finally, you document the test in the log, including the date, operator, unique identifier, time test started, read, lot number, and expiration date. Thank the patient one last time and remind them when their test results will be ready. Thank you for watching this video, and we genuinely hope that this is helpful to your rapid hepatitis C testing program.
So one thing I want to point out here is that this tester went ahead and ran their test at the table where they performed the screening. That's certainly one way to do it. I have seen situations where there are multiple people to be tested and it gets a little bit crowded and you have people waiting. And so it may not be appropriate to do the testing right one at a time, right as you've received the specimen. And so you might want to consider doing what I'm referring to as batch testing. So let's say this lady finished testing. Instead of dunking the test kit into that solution at that moment, she would just cap the solution and bring it back into the lab and bring another person in to start testing. And in this situation, you would need a lab technician, someone in the back. You are able to have the blood specimen that you've collected inside the testing specimen, the vial, for up to 1 hour, 60 minutes after you have collected it from the person. You have 60 minutes to run the test from there. And so sometimes it might be helpful to get 10 people in a row, provide their testing, be sure that you indicate by log numbers which test belongs to which person, and bring them back into the lab and actually dunk the test kits all at once. So all of the timers might start at the same time. And this just depends on how many staff and volunteers you have available, and of course, how many people you have there to get tested. And one thing I'd like to point out are some of the resources that OraSure technology offers for training. This is a certificate of completion that's an example. I went online and watched some videos, and they're able to train you. And after answering a pre and post test, you'll be able to receive a certificate to show that you are able to be an administrator of the hepatitis C test kits. This is something I encourage you to review, especially since OraSure is the only approved, FDA-approved hepatitis C test. So as I mentioned, we really developed this program to meet some of the program gaps that exist within viral hepatitis. And one thing for me that I always saw is missing and continue to see is missing is a similar training program or toolkit that exists for hepatitis C rapid screening and testing, similar to the way it exists for HIV. And so this is a document that I put together called Parts and Pieces, Hep C Screening and Counseling, and you'll be able to get this on the resource page for Module 2. I encourage you to download this and share, and it's divided up into these 5 sections of the pre-test and all of the components that you should get together and keep in mind before you even start testing. What needs to happen during the pre-test process, conversations with the constituent that you are testing, all of the elements that go into that. And then the process by which you would screen and test, the lab process and what that would look like, and post-test counseling messages. So I highly encourage you to read this and download it, share it with your colleagues, and see how it might help in the process of hepatitis C screening and testing in your program. So when you're screening, and this is something I mentioned earlier, but when you're screening through lab-based testing, okay, this is when you are drawing someone's labs into a vial, there is no situation where that clinic should order an antibody test only. We talked a little bit about reflex testing. And so what's necessary is that if that person whose lab you just took was in fact exposed and did have a positive antibody test, it would be vital for us to determine if they have active infection. And the only way to determine if they have active chronic infection is to do what we call that confirmatory viral load test. And so in order to confirm it, we would want to reflex over into that HCV RNA quantitative real-time PCR. This is a very fancy way of what the lab might call it. And so the reflex testing, it saves time, it saves money, and it reduces stress. Because imagine that Miss Jones comes in and you test her, or you draw her blood and you test for antibodies, and it's reactive. But let's say that you did not check on the laboratory requisition, the reflex, the confirmatory. That means you have to call Miss Jones and say, "Hi, Miss Jones. I think you may have Hep C, but I'm not sure, and you'll need to come back in so we can run a lab test and confirm viral infection." Now, most laboratories, having nothing to do with anything that you'll have to check on a requisition, but in their own processes, many labs will automatically reflex if the antibody is positive. But not all labs make that a standard practice. And because not all labs make that a standard practice, and there is testing all over the country, please be sure that in your lab-based testing that you ensure that if someone has a hepatitis C antibody test, that you mark the reflex. If there is no antibody reactivity, if it's negative, it will not reflex. That part of the lab will not happen. You need not worry about costs in that regard. Something to keep in mind for your clients who you're working with who have been confirmed. They got an antibody test that was reactive and then it reflexed into an RNA, and that was positive. We would want to go ahead and test them with a few additional things: a genotype, a CBC, a hepatitis B, surface antigen. We're going to go in a little bit into what these are in the vaccine module, which is module 3. You can't see this, but HIV. We want to be sure, once we find out that they have Hep C, we want to be sure and test them with these to find out any types of co-infection. And this will help in terms of staging as well. In terms of testing, what has changed? It hasn't always been that the CDC or the United States Preventative Services Task Force, you'll see this USPSTF, it has not always been that these entities have encouraged testing across the board for everybody, and it has impacted insurance, the coverage of insurance covering the costs of these tests. Some of what's changed is that as of March of 2020, just a few months back, the CDC and the USPSTF has changed and updated their screening recommendations such that all adolescents and adults age 18 and over get at least one-time testing. Something else that has changed, genotype testing. So that's something that haven't really talked too much about yet, and we will talk a little bit about that in some upcoming modules. But I like to think of a genotype, if you could almost think of it as like a variant. So we have hepatitis C, and there are various types of hepatitis C, or strains almost, and those are genotypes. And there's a genotype 1 all the way through 6, and those have become less important to determine because our medications that we have now are what we call pan-genotypic. They don't target just one genotype, but the medications are actually useful for all of the genotypes. And this wasn't always the case. There used to be some medications that would only treat genotype 1 or genotype 3, and that is no longer the case. And this is huge as it opens up opportunities for people to get cure. What else has changed? We are seeing a huge influx of people being diagnosed with fatty liver disease. And this is something that is attacking many Americans with or without viral hepatitis or hepatitis C infection. And so for the general population, because of generally our higher fatty diets, we are seeing an increase of fatty liver disease. And just a note, you do not have to be fat to have fatty liver disease. This is really more about the way that the body processes things and what's left over in the liver. So something that's also important with this for folks who are living with Hep C, if you have genotype 3, this is oftentimes associated more with fatty liver disease than the other genotypes. And so for your patients who have genotype 3, want to make sure that you're monitoring, of course, general liver health, but especially fatty liver disease. We are seeing some changes that some of the new HIV funding and some of the new funding to address opioid use disorders is allowing for hepatitis C testing. So be sure to look at your funding announcements and your cooperative agreements to see. I know that the CDC allows, in some cases, up to 10% of a budget, an HIV budget, to be used for hepatitis C prevention services. So be sure to check that out. And of course, in the day of COVID-19, as COVID-19 testing is coming online, we want to keep in mind a few things. That if you are going to start testing for COVID-19, how are you able to do some parallel testing, especially for our folks who might be at disproportionate risk for infection? How might we be able to parallel test alongside hepatitis C or HIV? We have learned and learning more by the day, but the treatments for COVID-19 might be harmful for the liver, especially if we consider that everything that we ingest goes into the liver. And so one thing that hepatologists are especially making concerted efforts for are watching out for those folks who have hepatitis B and controlled hepatitis B, that they're seeing some resurgence and some flares of hepatitis B infection. So it's important to know your status if you have Hep B, and certainly getting vaccinated if you are vulnerable. In terms of the tools and resources available to you, I highly encourage you download the parts and pieces report that I put together. Check out the OraSure link, and you can register for an account at this link right here, and it will take you to where you'll be able to see some of those online trainings, the tests, and being able to get certificates as well. I'd encourage you to check out CDC's viral hepatitis program. There's great reports and there's great tools and infographics. Also things that you can use for any of your social media accounts as tags and whatnot. So I encourage you to look at that. And as we talked about the last module as well, I had encouraged you to look at the SAMHSA tip manuals. There are some specifically about testing for hepatitis C within addiction treatment programs. And so there's some really helpful tools and resources you'll see in those tip manuals. So congratulations, you have finished Module 2. Module 3, actually it says staging. Module 3 is actually going to be vaccination. And vaccination is coming up next. And vaccination ultimately will help orient you to the role of AB vaccination and the practices of how you can help folks living with hepatitis C manage any of the prevention or risks that they have for A and B. So be sure to check in with Module 3. If you are looking to get a certificate of attendance or CEs, please be sure to complete your post-test survey, and so that will gear you towards where you can get your certificates and your units. And as always, please be sure to check out our resource page and contact us with any questions that you might have. So thank you for being with us during Module 2, and we'll see you at Module 3, vaccination.